Ever wondered how surgeons perform lengthy and complex operations without the patient feeling a pinch of pain? Well, the answer lies in the fascinating world of anesthetics. These are the wonder drugs that numb our senses and make surgical procedures tolerable, even when they last for hours on end. Anesthetics play an indispensable role in modern medicine. Imagine a world without them. Even the simplest of procedures would turn into a torturous ordeal. Pain, after all, is not just a physical sensation, it is intricately linked with our mental well-being. Incredibly, anesthetics don't just numb physical pain, they also help in reducing the psychological trauma associated with surgery. But the path to this advanced form of pain relief was not straightforward. It was fraught with challenges, experiments, and quite a few unexpected discoveries. The journey of anesthetics is a testament to human ingenuity and the unrelenting quest for progress. But how did we arrive at this sophisticated form of pain relief? Let's delve into the history of anesthetics. Pain relief isn't a modern invention. It's as old as human civilization itself. Indeed, our ancestors were no strangers to the concept of pain relief. They might not have had the advanced medical knowledge we have today, but they had an intimate understanding of the natural world and the power it held. Let's journey back to the dawn of civilization, where the first evidence of anesthetics comes from. Ancient civilizations, including the Sumerians, Egyptians, Greeks, and Romans, explored the use of natural substances like herbs, alcohol, and opium to numb the senses and provide relief from pain. These were not just mere folk remedies, but were used in serious procedures like surgeries, demonstrating early humans' innovative approach to pain management. Take, for instance, the poppy plant. The Sumerians, one of the world's oldest civilizations, discovered the pain-relieving properties of opium derived from poppy seeds as early as the 3rd millennium BCE. They passed this knowledge along to the Assyrians, who then shared it with the Egyptians. Alcohol, too, has a long history as an anesthetic. The Greeks and Romans, for example, often used wine to dull pain during medical procedures. The alcohol would render the patient unconscious, allowing the surgeon to operate without causing undue distress. However, these early forms of anesthetics were not without their risks and limitations. Dosages were difficult to control, and the line between effective pain relief and fatal overdose was often perilously thin. Moreover, these substances only provided temporary relief, and did nothing to prevent post-operative pain or infection. Yet despite these challenges, our ancestors persevered. They recognized the importance of pain relief in medical procedures, and their relentless pursuit of better methods laid the foundation for the anesthetics we use today. Though rudimentary, these were the stepping stones to the development of modern anesthetics. The story of anesthetics is a testament to human ingenuity and the relentless pursuit of knowledge. It's a story that begins in the mists of prehistory but continues to unfold to this day, as we'll see in the next part of our journey. The 19th century marked a significant turn in the history of anesthetics. A time when the dark clouds of agony began to dissipate as science started to uncover more potent ways to relieve pain. In the heart of this century, two substances emerged as game-changers in the field of anesthetics: ether and nitrous oxide. The former, also known as diethyl ether, was a colorless, highly volatile liquid with a characteristic sweet smell. Nitrous oxide, on the other hand, was a colorless, non-flammable gas, often referred to as laughing gas due to the euphoria it induced. Ether's journey in anesthesiology began when Crawford Long, an American physician, noticed that individuals under the influence of ether showed no reaction to physical pain. Long conducted an experiment in 1842, using ether to remove a tumor from a patient's neck. This was the first recorded instance of ether being used as an anesthetic. However, it remained a quiet discovery as Long did not immediately publish his findings. 4 years later, the world witnessed the first public demonstration of ether as an anesthetic. William T.G. Morton, a Boston dentist, successfully used ether to extract a tooth in front of a live audience. This event, famously known as the Ether Dome, marked a significant milestone in the history of anesthetics and surgery. Around the same time, nitrous oxide, discovered by English chemist Joseph Priestley, was also gaining recognition. Though initially used for recreational purposes, its anesthetic properties were soon discovered. Horace Wells, another American dentist, was the first to use nitrous oxide for painless tooth extraction. These discoveries were monumental. They not only alleviated the suffering of patients, but also allowed surgeons to perform more complex and longer operations without causing distress to the patient. A new era had dawned, an era where the patient's comfort during surgery was becoming a possibility. These advancements revolutionized surgery and opened new possibilities for medical science. The birth of modern anesthetics had begun, paving the way for leaps and bounds in the field of medicine that we see today. The 20th century brought in more sophisticated and safer anesthetics. As the calendar turned into the 20th century, the field of anesthetics took a significant leap forward. The development of local anesthetics became a game changer. Among these were Novocaine and lidocaine, two significant anesthetics that still hold a crucial place today. Novocaine, introduced in the early 20th century, was a revelation. It was primarily used in dentistry for its numbing effect, allowing for painless dental procedures. This development was a massive relief for many who dreaded the dentist's chair. Then came lidocaine in the mid-20th century. It was superior to Novocaine in many ways, offering a faster onset of anesthesia and a longer duration of action. Lidocaine found its use in various medical fields, from minor surgeries to the treatment of irregular heartbeats. But the evolution didn't stop at local anesthetics. The 20th century also marked the invention of balanced anesthesia. This method combined different types of anesthetic drugs to minimize their individual side effects while maximizing their benefits. This approach allowed for safer, more controlled procedures and significantly improved patient comfort and recovery times. Another important introduction was muscle relaxants. These drugs, used in conjunction with anesthetics, allowed surgeons to operate with less force, reducing trauma and speeding up recovery. They also gave anesthesiologists more control over a patient's vital signs during surgery. These advancements were a testament to the relentless pursuit of medical science for more effective and safer methods of pain relief and surgical procedures. Anesthesia had come a long way, but the quest for the perfect anesthetic was far from over. The evolution continues, and with each passing year, we see new developments and improvements in the field of anesthetics. It's a journey that promises a future where pain and discomfort during medical procedures could be a thing of the past. Fast forward to the 21st century, and we're in the era of precision and personalization. The field of anesthetics has been revolutionized by advancements in technology and our deepening understanding of the human body. Today, anesthesiologists aren't just administering one-size-fits-all drugs. They're creating personalized anesthesia plans tailored to each patient's unique physiology and surgical needs. One of the most exciting advancements in recent years is the use of ultrasound-guided regional anesthesia. This technique allows anesthesiologists to visualize the exact area where the anesthetic needs to be administered, ensuring a more targeted and effective approach to numbing the pain. This not only increases the safety and effectiveness of the procedure but also significantly reduces the risk of complications and side effects. But we're not stopping there. The quest for better, safer, and more effective anesthetics continues. Researchers around the globe are tirelessly working to unearth new methods and drugs. They're exploring everything from the potential of genetic testing in predicting a patient's response to anesthesia, to the use of artificial intelligence in managing and monitoring anesthesia during surgery. It's an exhilarating time in the field of anesthetics, and the future holds tremendous promise. With each passing day, we're getting closer to achieving the ultimate goal of every anesthesiologist and patient alike: a pain-free surgical experience with minimal risk and maximum comfort. The journey of anesthetics is a testament to human ingenuity and the relentless pursuit of pain-free surgery. So, from herbs and alcohol to precision anesthetics, the journey has been long and eventful. We've traversed through ages, witnessing the primal attempts at pain relief, the birth of modern anesthetics, and their continual evolution. The mystery of pain relief began with humble beginnings, using nature's offerings like herbs and alcohol. As our understanding deepened, we saw the dawn of modern anesthetics, revolutionizing medicine and surgery. The evolution didn't stop there. As we moved forward, anesthetics became more refined, more precise, and safer. Today, they are an integral part of medical science, allowing complex surgeries to be performed with minimal discomfort. They have truly transformed the patient experience, reducing fear and anxiety associated with surgical procedures. The journey of anesthetics is a testament to human ingenuity and the relentless pursuit of knowledge. It's a story of progress, of how far we've come in our quest for painless surgery. Who knows what the future holds for anesthetics? But one thing's for sure: the quest for painless surgery continues.